Well, about a year ago, I promised my vast social media following that I would do a video about how it was that I came to discover that I had cancer. In fact, I discovered that I have stage 4 esophageal cancer, which is cancer of the esophagus. Stage 4 means it's metastatic. That means it's no longer contained in the esophagus, but it has spread to other parts of my body. So I was in Nepal at the time, living in my home in Budanilkanta, and I began in late February of 2021 or early March of 2021 to have these backaches. And I would have to lay down every afternoon for 30, 45 minutes to get some relief from this back pain. So I went to Helping Hands Community Hospital to see my good friend and longtime physician, Dr. Gupta. Actually, it's Dr. Shrestha, but he goes by Gupta. Shrestha is his name, and everybody calls him Dr. Gupta. So I saw Dr. Gupta, and he sent me over to see an orthopedic guy who had an x-ray done of my spine, and that showed everything was fine. Nothing was being caused by a spinal misalignment or anything wrong with the spinal structure. Then we did an ultrasound, we did some blood tests, and we couldn't come up with any reason why I was having these backaches. So I just let it go at that. After a couple of weeks, the backaches weren't getting better. In fact, they were getting worse. And so I decided to go back and see the doctor again. So I go back and I see Dr. Gupta, and Dr. Gupta says right off the bat, he says, a week or so ago you didn't appear sick, but today you look sick. So let's dig into this further. So we decided to do what's called a CT scan. Sometimes people refer to it as a CAT scan. And that scan revealed that there were some abnormal looking lymph nodes in my abdominal area. And Dr. Gupta had an internal medicine doctor examine me and take a look at the CT scan results. And then he said to me, if you were Nepali, I would suspect tuberculosis because what we're seeing in the CT scan would be consistent with that. He said, but you're not Nepali. You're an American, and so I would suspect more cancer in that case. And so that left me with a dilemma. Do we move ahead with treatment for TB, not having certainty that it is TB? Should I move ahead with cancer treatments, not being certain that it is cancer? And we determined the only way we can, have a discussion about this is let's get a biopsy of one of these lymph nodes and see what that biopsy reveals. So I spend the next month and a half attempting to get a biopsy. Dr. Gupta originally sent me over to Teaching Hospital. He said they've got the best equipment over there, the most modern and newest stuff, and go see them, because the way they do these biopsies is they use an ultrasound to guide a needle to go in to the lymph node and extract a little piece of tissue that they can send to the pathologist and see what that tissue is comprised of. So the first time I went to Teaching Hospital and talked to the doctor there, I informed him that, hey, I take a antiplatelet medicine called clopidogrel because 3 or 4 years prior to that, I'd had a blood clot in my left leg, and we ended up having to put a stent in that leg. And as part of the follow-up treatment, I continue to take this antiplatelet medicine to keep that stent open and working. So the doctor said, okay, you've got to go off of the antiplatelet medicine for at least 5 days before we can do this biopsy. And so I did that. I stopped taking the medicine. I went back after 5 days. I said, okay, here I am. I'm ready for the biopsy now. There was a discussion that took place between the hospital administrator, who had come with me from Helping Hands, and the doctor, but that discussion took place in Nepali, so I don't know exactly what was said. I know that at the end of the discussion, the doctor there at Teaching Hospital was still reluctant to perform the biopsy on me. And so we left with no biopsy. And then the next step is we went to another hospital where I met once again with a doctor, and we looked at the scans, we looked at all the information we had, and that doctor also declined to do a biopsy. So that's two hospitals now that didn't want to do a biopsy on me. Now, I still don't know the reason why. I suspect it could be just a case of them thinking, well, you're an American, why don't you just go home and do this stuff at home? Which is reasonable. I mean, there's some risk involved in doing one of these biopsies where you're going through the body and you're inserting this needle. You could hit a blood vessel, things could go wrong, and they didn't want to have responsibility for that. And if that's the reason, I can totally sympathize and respect that reason. So then we went to a third hospital. Actually, we went to Meta City Hospital. And there we met this young doctor who said, you know, I trained in Thailand on how to do a biopsy like this using CT guided instead of ultrasound guided. And I'm ready to do that biopsy right now if you're ready. And so after a month and a half, I said, of course I'm ready. Let's do it. So 30 minutes later, I'm in on the table where the CT scan is, and this young doctor uses the CT machine to precisely guide a needle into where there's a lymph node and extract a piece of that lymph node tissue that can then be sent to the pathologist. It took a few days, and we got the results back, and the results indicated that it was cancerous. And so at that point in time, I determined that for cancer treatment, I should go back to the United States. Had it turned out to be tuberculosis, which actually, it's kind of bizarre, but in an odd way, I was hoping for tuberculosis and not cancer, believing that tuberculosis was the lesser of those two evils. But had it turned out to be tuberculosis, I probably would have stayed there in Nepal for treatment, because they still have a lot of tuberculosis in Nepal. It's still prevalent there, and the medical doctors there are pretty adept at treating it. In fact, Helping Hands Community Hospital, where I first went, they've got a treatment center there for tuberculosis. But I determined that since it was cancer, we probably had better facilities in the United States of America for treating cancer, and so I came home. Upon returning back to the United States, I went to a cancer hospital here in Albuquerque, New Mexico, where they did an additional PET scan. And that's when I found out that the source of the cancer was the esophagus. I didn't know that part when I was in Nepal, because we hadn't done a CT scan, what they call a skull base that goes from here on down. We'd pretty much only done the abdominal region where we were seeing this activity with these unusual looking lymph nodes. So that's when I first learned that it was esophageal cancer. That hospital staged it in that original PET scan. They staged it at stage 3. But then I went to Presbyterian Hospital and met with an oncologist there. And he staged it at stage 4. And the difference between stage 3 and stage 4 is really a matter of how far the cancer is away from the original tumor. So if the original tumor is in the esophagus and you have lymph nodes that are nearby that are affected, then they would call that stage 3. If they're distant, which they consider the abdomen to be distant, then it's stage 4. It's traveled farther in the body, and so that puts it at stage 4. If you Google the stage 4 esophageal cancer, the statistics for that are grim, so my suggestion is don't Google it. Because some of those statistics and articles and things that are on, that show up on a Google search are rather old. They don't represent some of the latest treatments that have been introduced to combat this. It nonetheless is considered an incurable cancer. It's one that medical science says they can control, but they can't cure. So for the last 2.5 years, I've been getting chemotherapy on a regular basis, and I had some radiation as well, because after the first 8 weeks of chemotherapy, almost all of the cancer that was in the abdominal lymph nodes had been removed. But there were still, I think, three if I remember right, 3 spots that were still lighting up on the PET scan that indicated those were cancerous lymph nodes that hadn't gone away with the initial treatment. So we determined that we'd try radiation on those 3 spots. And it worked. Those 3 spots did go away, but they were quickly replaced with a couple of other spots instead. So I think I've had 46, 47 rounds now of chemo over 2.5 years. I forget exactly how many rounds of radiation I had, but it was a number. It stretched over like 3 weeks. At this point in time, the cancer is considered stable. It's not shrinking anymore, although it's been considerably shrunk already. But it's not growing. And in the world of oncology, as my oncologist put it, stable is good news. So that's where we're at. That's how I came to find out that I've got stage 4 esophageal cancer. That's why I've been in treatment for 2.5 years. I'm doing well, considering that I do have this cancer. It's great that it's not growing. It would be even greater if it would shrink more. And the greatest would be if I could go into complete remission, where the PET scan showed I didn't have any cancer at all. And maybe that'll happen and maybe it won't. There's no way to tell. You just keep doing the treatments, cross your fingers, and hope for the best. So anyway, that's the story of how I found out about my cancer. I don't call it a cancer journey. I call it a cancer battle, because it's much more like a battle than a journey. When I think of a journey, I think of taking a nice trip somewhere. And there's nothing nice about this trip of getting treated for cancer. I go in every few weeks, they give me chemotherapy, I then spend a week being sick as a dog, and then I slowly recover, and then I go back in for chemotherapy again. And that's kind of how it goes. There's a bunch of side effects that go with it. I have a ton of neuropathy in my hands and feet, which is nerve damage, which means my fingers are always freezing cold and my toes are always numb. That makes it a little bit difficult for me to walk some days because I can't feel where my feet are. Some days I can't drive my car because I can't feel where the gas and the brake pedals are, or I can't feel them enough that I feel safe and comfortable driving the car. I'm probably not going to be posting up any more videos about this cancer business, because the internet's already flooded with cancer patients as far as I'm concerned. And like I said, there's nothing really to report. Every few weeks I go, I get chemo, I spend a week sick, I get better, I go back, and we lather, rinse, and repeat, as your shampoo bottle says. So unless something really changes dramatically, either the cancer grows or I end up with a PET scan that shows I am in remission, I won't be back to talk about my cancer anymore. It's not a favorite topic of mine. I try very hard to just keep it out of my mind, actually. I don't want to be thinking about the cancer. I don't want to be thinking, oh, I'm a cancer patient, all that kind of stuff. I want to stay focused on being in the present, on making little videos like this, and doing things that make my life as close to normal as is possible at this point. So for those of you out there who are also battling cancer, I wish you all the very best of luck. I hope you all get well soon. Keep fighting. Don't give up. Keep a positive attitude. Keep your mind focused on your healing and not on your disease. All right, that's it. That's the whole story. Thanks.